2 layers of architectural stuff.
Good. All right. Call to order. Okay. I'm going to call the meeting to order. Ms. Hackathorn, could you call roll, please?
Dr. Moore,
Yes.
Ms. McGregor,
Yes.
Dr. DeGuzman. Here. Ms. DeWitt. Here. Mr. Adamson.
Here.
Mr. Griffith.
Here.
Ms. Johnson. Here.
Okay, we can have a quorum for this meeting. Wonderful. Any additions or adoptions to the agenda?
Dr. Moore, under new business, 6D, the solid waste nuisance at 9,000 Selma Pike, we can strike that from the agenda. As of a few hours ago, that nuisance was abated.
Wonderful. Okay. So can I have a motion and a second to adopt the agenda as presented with this modification?
So moved.
Second.
Okay, and, can we have a voice vote? All in favor?
Aye.
Opposed? Same sign? Okay, motion carries. All right, so we are looking for approval of last meetings. Ooh, that's easy for me to get out. Meeting minutes, April 16th. Are there any additions or modifications? Okay, could I have a motion and a second to adopt the minutes?
So moved. Second.
Okay, all in favor?
Aye.
Opposed, same sign. Okay, motion carries. All right, so we're at the point for public comments. Aside from Mr. Smith, do we have anyone else? Okay, then we'll have him speak when we get there. Okay, so, Shannon, I already talked to you about that. Thank you very much. Okay. All right, under old business. Okay, construction and demolition dirt debris license. Springfield landfill.
So for the Springfield landfill, what we are asking is that you continue to table the 2026 license. Over the past few weeks, we have had some discussions and further discussions with the owner and also his consultant. And at this time, we are asking for the board's approval to submit an intent to approve letter to the Ohio EPA. The letter is requesting an exemption to the requirement for the maximum slope to not exceed 25%, and the Springfield landfill has submitted a slope stability study that's in your packets to support the proposed 33% slope. And the proposed modifications to the facility will be unlikely to present hazard to the environment or the public's health. And then once this letter is signed and submitted to the Ohio EPA, the EPA will review the license application packet, and we anticipate the application to be approved, and we would then bring that forward or back to you guys at the June board meeting. And then we also ask that you allow them to continue to operate under their 2025 license at this time.
Okay, we want Mr. Smith to talk at this time. Okay.
And I don't know why you haven't went ahead and okayed this, because nothing's changed. Everything's the same. Only thing is, I spent $175,000 so somebody could be satisfied that we was in our limits and we weren't, our hills were stable. And there's nothing else wrong with that place. The only thing was wrong was Ann Compat. I told her we was in our limits. She got kind of mad about it. And she had taken and put all this stuff up. It wasn't nobody but that right there. It's a simple thing. Nothing's going to change out there. I could do my elevations and stuff if everything was okay. But, that could have been done back in January, February, March, when we weren't busy, and it's all held up because of one thing, elevations. And I'm getting the same notice every month that it's held up, saying your elevations, we assume your elevations aren't right, okay? I mean, if they're not right, why don't you guys send somebody out there and check them out? Ann was out there for 20 years, 20 some years. And, she done find every month. And, if something was wrong then, she should have said something. And and it would have been corrected the way you guys want it. Well, we've always thought it was 3-1. If it's 4-1, that's just, we're out of business, okay? And that's, but you know, and we talked a lot of things, but I don't think we've thrown any bad water over on anybody. We don't throw trash over on nobody, you know, and we try to put the stuff in the ground that's supposed to be in there. And we haven't done anything wrong. And all of a sudden, this is all brought up like that right there about these licenses and stuff. And they want to fly over every year. You know, that's just money spent for nothing. It's going to be done again in another 5 years. And all this stuff, if it's not right, I got to fix it, or the insurance got to fix it one. You know, it's insured, it's bonded. If something's not right, you know, it will be fixed. I've always did what I said, and I've had a good relationship with the health department and everything. I'm not, like I said, they had dust on the road when I got that place, I paved the road. I water down out there. I try to keep all the dust down I can. You know, we haven't got a lot of people that work out there right now because you can't find anybody. Nobody wants to work. And that's it. That's all I gotta say, but, you know, I spent a heck of a lot of money last year, and it was for nothing, nothing at all. Just to to satisfy somebody. And I just think it's wrong.
So,
And, you know, the thing is, you know, it's gotta be 3-1. Okay, and that's it. Is it 3-1?
it
I
is,
can't hear very good.
3-1 is what
Okay,
is being
I
approved.
forget.
That's what's
what
being
it's always
approved.
been.
That's
Sorry,
what's
I
being
didn't
approved for
interrupt
you.
Go ahead.
Yeah, so the variance is to give you the 3-1. That's what the variance exemption request is.
I didn't see what the things with the license, what he applied for. I know it's been a long time. He's telling me, oh, they're not gonna do this, and all I've done is write checks to them, okay? And then, you know, that place is not a money-making place now. It doesn't do the volume of trash at Rumpke or, you know, IWD or somebody. We're not them. We're small business.
So for the board's knowledge, we don't have local regulations. We're enforcing state rules and codes. So it's, you know, Ann has done a great job, and now she's retired. It wasn't just her personal mission on any of these, it's the state law. And that maximum slope of 25% has been in law for a very long time. And so the exemption request, and actually this is the signed letter, I've already signed it. We're gonna send it to EPA tomorrow. It's our intent to approve his license package with their approval of the 33%, that 3-1 slope. So EPA has already said, based on the stability study, we're good with it. It's a variance from the law, and that's why it took time. And so when they get this letter, EPA will go through with their approval, and then we can approve it at the next board meeting in June. That's what I anticipate happening.
And Chris, how long will that variance last? Will he have to go back through this every year, or?
No, he
Okay.
won't have to go through that variance process, that exemption process.
So it's just one and done?
Correct.
Okay.
I mean, right? Now I'm second guessing myself now that you asked the question. It's a one-time variance request, exemption request.
Yep, as long as we
It is.
maintain those same cross sections, the vertical and the horizontal cross
Right.
sections.
It is.
And that is as long as he owns it.
And that's what I hesitate. I don't know if a change of ownership does something. I will find that out because I don't know. If you were to sell it, if the exemption goes with him or it goes with the facility, my gut tells me it's with the facility. It's not with the person, so, but I'll find out.
Are there any other questions?
No, I'd just like to say, like I said, we drug this out for a long time. Nothing's changed. I mean, tell me one thing that's been changed out there. It was all because of one person, and that's it. And I talked to EPA 2 months ago, the same guy they had up here. He said he didn't have his guy's name was Aaron, I forget his last name, but he said he didn't have nothing to do with that. He said that Ann Coppett had called him. Is that true?
I mean, we talk to the EPA regularly. They talk after every time she's done an inspection in the last 20 years.
Well, like I said, I've owned it for 21 years. I've not had that much problem out there, you know? I mean, I've tried to take it. I had a lady complain about the lights out there, and they shut them off because of that. Said she couldn't see the stars. So we just turned the lights off out there so far up. We try to be a good neighbor to everybody. We, like I said, we don't run no water. We don't put no trash over on nobody. And we do haul a lot of stuff down to the transfer station. This stuff's not gonna be there. People aren't honest what they put in your containers, or what they dump on the bill out there. They're not honest. They cover things up, we have to dig them out. Pick them up. We try to keep everything done like that. We got like 3 guys that work out, 3 or 4 guys that work out there, and they just, they try to keep everything clean.
So it sounds like the variance is going to be approved, and at our June meeting, we will approve that. And then I think that will be the end of the frustration for you.
Like I said, we could have had everything fixed on that right there that we wanted. But that was the slow months that we have to use, okay? We're not gonna take away from other businesses to do that. But, we could have had everything done. But every time we get a break in between something, we'll work on,
So we thank you for bringing your concern forward.
Thank you. Like I said, I've always had a good relation with the health department. No problem whatsoever. Just always been one person.
Is there any further discussion? Okay, Ms. Shannon, Moore. Oh, give me a motion and a second tabling the approval of the 2026 license for the Springfield landfill. And approving the submission of, number 1, intent to approve letter for the request slope exemption of the Ohio EPA. And recognize that the Springfield landfill may continue to operate under their existing license until the board takes further action. Can I get a motion in a
So
second?
moved. Second.
Okay, any additional discussion? Ms. Hackathorn, roll.
Mr. Adamson,
Yes.
Ms. DeWitt,
Yes.
Dr. Moore,
Yes.
Mr. Griffith,
Yes.
Ms. Johnson.
Yes.
Dr. DeGuzman.
Yes.
Ms. McGregor.
Yes.
Okay, motion carries. Moving on to new business. Sewage variance requests.
All right, so the property owner of 820 West Sparrow Road is requesting a post installation variance for a concrete in-ground pool deck that is approximately 6 feet from the current leach field. Code requires that 10-foot minimum distance between the hardscape and the septic system. This property is greater than 5 acres, so it is likely to have enough space for a replacement septic system. And we have reviewed the request and would not be opposed to you guys approving this variance as is.
So I'm asking for a motion and second to approve the sewage variance.
So move. Second.
Any questions? Ms. Hackathorn, roll call.
Ms. Johnson,
Yes.
Dr. Moore,
Yes.
Mr. Adamson,
Yes.
Ms. McGregor,
Yes.
Dr. DeGuzman.
Yes.
Mr. Griffith,
Yes.
Ms. DeWitt.
Yes.
Okay. And moving on to the Rumpke Transfer Center application.
Yes, all right, so I'm sure you guys have heard about the Rumpke Transfer Center coming to Clark County, but we're getting pretty close. Actually very close for it to being ready to operate. So the transfer facility is the first one that is located in our county. The facility is located at 3580 South Dayton Lakeview Road out in New Carlisle. Up to this point, all the construction approvals and all the permitting has been done through the Ohio EPA. And now the local health department here, we are solely responsible just for the licensing factor and then the compliance inspections annually. And we, once again, like Chris mentioned, we will do those inspections per the Ohio EPA rules. And on Tuesday of this week, myself and a couple others went out to the facility for a tour and a pre-licensing inspection of the facility. And we were able to take some pictures to kind of give you guys an update as to what it is, first of all, what it looks like.
So these are a little out of order, so
Yes.
you might see like inside, then outside, then
Yeah.
inside again, so just bear with us.
So this is the overhead view. The first building there towards 235 is offices, maintenance center.
Back here.
Yep. They have their compressed air hookups there in the middle. I believe that's also where the truck wash.
The truck wash is next to the actual transfer
There we
station.
go. Yeah. There's the scale, so the trucks would pull in off of 235, go through the scale, and then go all the way to the back of the property. And there are 4 overhead doors for the trash trucks to come into, to dump, and then it will be loaded into the trailer, which is at that bay down there.
It's tough to see. This is a really large facility. It's tough to really appreciate that from aerial. But like Megan said, along here, these are all compressed natural gas fill-ups. So there's got to be how many hookups?
A lot.
I would estimate there's got to be 50 hookups at least
Yeah,
for the
some are
compressed
slow
natural
fill,
gas.
some are fast fill, so
Yeah.
it's really nice too.
But like Megan said, they'll come in off the road here, hit this weigh station, and then go back. We've got some pictures along the back here. The wash area is right here. It's kind of just a lean-to almost. Just for your knowledge, I don't think you mentioned this yet, there's no trash that stays here overnight. It is literally what it sounds like. It's a transfer station. All the little trucks that you see, there's a couple in here, come in here, they dump, and they put them on larger trucks to go to landfills. There's no trash that's stored overnight in any trucks and inside the facility. I've been told by Rumpke staff, and when we've talked to other health departments that have these transfer stations, at the end of the day, it's like there was never trash in there. So I guess I can move on to another couple pictures here. So this is the back side of that. This is the maintenance bays right here, front offices here, and you can see all these natural gas hookups along here for all their trucks. This is inside the transfer station. Point out a couple of things here. This is basically the big dumping floor. This is where the trucks come in, dump it, they sort it, and then you'll see in a moment they dump it over top of this ramp that allows them to fill the large trucks that go to the landfills. I have a close-up of this. I think it's pretty innovative. I'll show you right now. You can see this. It's hard to see, but this is like a nozzle. They have this pretty interesting technology. You'll see it on the outside. It's looks like a cargo container. And what this does, this system has sensors all over it and cameras that it can detect flash points of fire. And it automatically kicks in and the hose moves and just shoots right for this foam right at the fire. Based on the cameras, and it uses radar, and it's with as many lithium batteries that end up in trash now, this is a real thing. They've had facilities catch on fire. And it wasn't a requirement to install this.
They've lost our entire facility.
They have. But pretty amazing technology. It was really interesting learning about it. So there'll be some other pictures later. Just another picture outside of the compressed natural gas. This wall right here is where they dump over into the large trucks that come in. We have a better picture of it here in a moment. And Megan got me in a picture. This is over top of that large barrier, right? So the larger trucks that go to the landfills, they back down this and they take a loader and dump into the larger trucks from the processing floor. And then they pull right back out. And I jokingly said, I would not want to be the one backing the truck down there. I tell you, these trucks are big, and there's not a lot of buffer you can see on the other side of that door. But pretty amazing. One thing I'll point out here too is you see this drain. They do capture all of the leachate, anything that's coming off, and all of that then goes to an oil water separator that we have a picture of, and then it goes in process to the sanitary sewer. And please interrupt me.
Chris, is all this hosed out every night
Yeah.
and taken
Yeah,
care of?
everything is clean. Like I said, they said you wouldn't know
You
there
don't
was
smell
trash
it,
there.
it's not,
Yeah.
it's deceiving how large this thing is.
Yeah.
It's a lot of concrete.
It is. This is that truck wash area where they can pull in and wash trucks or do whatever they need to. I'll skip
And
through a
that
couple.
wash bay is actually right where the oil separator is.
Yeah, it's on the other side. Yeah, I think I got a picture of it here in a moment. This is the outside of that transfer facility here. Let's see. There's a little bit more of a close-up of, see if we can zoom in a little bit. The nozzle. And you can see the cameras on it. There's several cameras above it too. Just amazing technology.
I think that's gonna be required in the future, I would guess.
There's your bays. There's all 5 of the bays. You can see, is that me too, Megan?
Maybe.
You can see how large the bays are. It is a very large facility.
So Chris, question, these trash trucks come in, do they dump directly into the big truck?
No, they dump on this processing floor, and then they do some separation.
Okay,
I mean, they'll find some tires in there. They don't put tires on the trucks. They take care of those other places, but things that they shouldn't be in the trash, they'll do separation. It was unclear to me if they have different trucks going to different types of landfills or not through the separation process. I don't know that, but it's just a continuous process where they dump on the floor, they do some moving, separating, and then they go into the trucks over top of this.
So the water, they separated, I get that, the oil and the water. And then this is tied into the public sewer.
Yes,
And so that's a lot of water going into the sewer.
it is. And I will tell you, through the whole permitting process, again, that's all through the EPA. They
Right.
have to make sure that the municipal water system can handle that, and it can. Yeah. Outside as well, I don't think we got any pictures of the outside, a lot of concrete outside too. And they've got multiple catch basins. There's a retention pond nearby as well for anything. A lot of rainwater is going to be going into that retention pond because there's just a lot of concrete outside. Yeah, actually, there it is. You can see a couple of them right here. There's one right here. And you saw in the aerial view, the retention pond is over top of here. Just a couple. Here's, okay, this is that fire suppression system right here. So they have a traditional sprinkler system. There might be another picture of that, but then this is the extra protection that they've installed. Like I said, it looks like a cargo container, but it's got this foam that shoots out of the nozzle. It's controlled by cameras. Pretty amazing. I think I have a slightly better picture, maybe not. So this is the top of the oil water separator. So the waste comes out this side of it. Bays are kind of on that side over here. And this is where they have a station here where they can service the oil water separator before it goes to the sanitary sewer. There's another picture of that nozzle. A retention pond in the back. Just a couple of different views of the inside here. Oh, yeah, these little scuppers. That's why we took this picture here. So this is the main floor here. Over top of that is where they dump into the larger vehicles. There's these scuppers all along here so when it's cleaned and rinsed at the end of the day, the water goes through that down to that main drain that I kind of showed you at the bottom of the ramp, and that's what goes out through the process of the oil water separator and then into the sanitary sewer. And that's the last picture.
Does it identify recyclable items versus trash?
He doesn't recycle.
So all these trucks are like solid waste trucks. None of them are, I don't, they didn't mention anything about that. I think you might be right, Cameron. I don't think they do.
We looked for people who would recycle, and none of them do anymore.
Did I miss anything? Anything you want to add?
So the large trucks will go onto the scale. There is a plan, but it's not really clear cut yet. We're hoping that the general public will be allowed to go out there and dump. Fingers crossed, that would be good, but we don't know the rates and fees and things like that. But they do have a plan to kind of divert the traffic so the commercial trash trucks aren't in the, but they have plenty of
Little
space.
cars.
Yes, exactly. So that's also exciting for us here to be able to, when we get calls about people cleaning out someone's garage or things like that, we can sell them. We'll have one 25 minutes down the road. So that's exciting. So,
How many trucks will they have to go through there a day?
oh gosh,
I don't think I heard a number.
we could have a lot. And ODOT is also making them put in you can see in that picture, a turn lane, which that'll help too. That's really the last thing I think that they're waiting on, I suppose.
Yeah, when we went out there Tuesday, they were,
Paving.
they were paving.
Is that part of them that's next door?
Where, here?
Yeah.
No, I don't.
That's the old footprint of what was there prior.
I don't know, I
They
just see
said
it.
it on
They
when it goes
did, and I
over
can't remember what it
there.
was.
The answer is no, but I can't remember.
I got to answer on it because I asked. I can't remember at the moment.
It was a storage facility,
There we go, yes.
like a pod storage facility.
Yeah.
Yeah, that's what it was.
The annual license fee of $750, if this is the first facility of this kind in the county, where does that number come from?
The Ohio Revised Code. It's set in state law. That's a good question.
Okay, I would like to have a motion and second to approve the license application of solid waste transfer facility. After we have the following conditions that must be satisfied, A through F, as you see on your report. And hereby authorizing the health commissioner to issue the license upon satisfactory compliance with the conditions outlined in this resolution.
So moved.
Second,
Could I have the vote, please?
Dr. Moore,
Yes.
Mr. Adamson,
yes.
Dr. DeGuzman,
Yes.
Ms. McGregor,
Yes.
Ms. DeWitt,
Yes.
Mr. Griffith,
Yes.
Ms. Johnson.
Yes.
Okay, motion carries. Okay, we have City of Springfield resolution support.
Yes, thank you. So I mentioned at the last meeting, last month, that the city commission is looking to pass enhancements to the existing tobacco retailer license ordinance that they have for the city of Springfield. So working with the city commission and Commissioner Ricketts that are here, we would like the board to approve a resolution of support for the enhancement so that we can give it to the city commission. The goal is to start the approval process within the city commission in June, correct? Correct, okay. So the actual resolution is in your packet. It's a little more formal than the normal resolution, just because we wanted to be able to give something to the city commission. But the big three main enhancements or changes to the current ordinance that we are supporting are increasing the annual license fee to $300, establishing a minimum proximity distance requirement of 1,000 feet between licensed tobacco retailers and youth-oriented facilities. Those that are already established will be able to stay, but no new ones can come in within that distance. And then increasing the penalties and enforcement of repeated violations. So it adds fines for a third and subsequent violations, and then has provisions for license suspension and revocation. So I'm just asking the board to pass the resolution of support that we can provide to the city commission as they go through their approval process. And Larry, if you want to say anything else.
I guess the only thing I really want to say is that what we're trying to do here is give this more teeth and make it so that these violations are not just a cost for doing business. And we want to be able to give the health department, who issues the licenses, the laws that they need to do this. I believe the ones that are closer to schools are grandfathered in, but if they go out of business and a new one wants to open, it's actually up to the health department to issue the license. And at that point, they can say no if it's too close to the school, which is a big deal. So, and we've ran this by our law department, and it means all that.
Larry, what about transfer of ownership?
Transfer of ownership,
So our licenses aren't transferable.
right?
Okay,
So-
so they have to start over.
Correct.
They have to start.
And
It
then they
would
would
be
have
like
to move,
closing.
yeah.
Yeah.
They would have to close and move.
Yes.
Yeah, that's actually under your jurisdiction.
Fantastic. And what, the enhanced fines, what does that equate to? And why is it on the third instead of the second?
Oh, believe me, I wanted to put it on the first.
I understand.
But our law department looked at other
Similar.
similar laws across the state, and this is pretty much falls in line. Okay. I actually wanted to, if it was up to me,
You could make a lot of money on
It
that.
costs you $1,000 to even get
Be a
your
revenue
permit,
source.
and then, but that, you know, we went with, not what I wanted, but what we could
What you could get done.
comfortably do and not, you know, because don't forget, this doesn't just apply to smoke shops. This also applies to convenience stores,
Grocery store.
grocery stores. So if it was just smoke shops, we can pretty much go in and do what we really want to do. But we do have to take into consideration the convenience stores and grocery stores and things like that also.
Thank you.
Thank you very much.
Scott, I have a question on maybe, what's the distance for a dispensary? From,
A dispensary, marijuana dispensary?
To a youth facility?
That's
I don't
regulated.
know. Yeah,
To my
I don't
knowledge,
think
it's not
it is.
regulated.
So new.
And that's all regulated at the state level.
Trying to campus.
Okay, so could I have a motion and a second to approve the resolution of support for enhancement of the city of Springfield's tobacco retail license ordinance as you have reviewed the resolution?
So moved. Second?
Okay, is there any additional questions? Ms. Hackathorn?
Dr. DeGuzman?
Yes.
Dr. Moore?
Yes.
Mr. Adamson?
yes,
Ms. McGregor?
Yes.
Mr. Griffith?
Yes.
Ms. Johnson?
Yes.
Ms. DeWitt?
Yes.
Okay. Make sure I'm on the right page. Grant submission.
This is over to me, since Emily is off on vacation, so I will do my best. You've got the grant application summary in your packet. This is not new for us. This is a renewal continuation grant for the WIC program. I can tell you that, see the funding amount requested, we don't have the option, that's what's assigned to us. But I can tell you that's about $45,000 more than we received this current year. The WIC program is one of those programs that I have always held very close, as not only beneficial from a benefit standpoint for our most vulnerable in our community, but also it teaches them something. They get the nutrition education, they get pointers for their kiddos, meals, things like that. It's a very good program. We want to be able to continue it into the next year. You might ask, what are you going to do with that extra $45,000, Chris? And great question. Thanks for asking it. The answer is we would like to write into the grant a part-time, wouldn't be able to get a full-time person for this, a health professional. So a dietitian to give us a little extra capacity. As you will hear in my report on WIC later, we are under, for the first time in a very long time, consistently under the 10-day requirement to get new certifications in. So someone's new, wants to make a new appointment, new certification for themselves or their kiddo, we're getting them in less than 10 days. And we've been maintaining that for at least 6 months now, which hasn't been done for a while. But we feel like we can grow a little bit and add a little extra capacity and access by another part-time health professional, an RDLD or a diet tech. So that's what we're gonna do with the extra money. Any questions about the WIC grant for the next year? You're pre-approving this one. This grant wouldn't start till October, but we have to submit it by, I think it's the second week of June.
I'd like to have a motion and second to authorize the health commissioner to do all things necessary, including submitting the grant application for WIC.
So move.
Second.
Any questions? Ms. Hackathorn, roll call.
Ms. DeWitt?
Yes.
Mr. Adamson?
yes,
Ms. McGregor?
Yes.
Dr. DeGuzman?
Yes.
Mr. Griffith?
Yes.
Dr. Moore?
Yes.
Ms. Johnson?
Yes.
Okay, motion carries. Pulmonology contract.
So our longtime pulmonologist consultant, primarily for TB cases, Dr. Bashir is retiring and moving away. And so he was very gracious to recommend a replacement. Isn't that always great when you get somebody to say, hey, here's the next in line. So Dr. Ranganwala, we met with him, I guess that was, when did we meet?
Last week? Last week.
End of last week?
Yeah.
Sat in this room and talked to him. He had some questions about the program. I think he's going to be a great addition to our TB control program in that consultative role as a pulmonologist. Contracts in your packets, pretty much in line with our previous contract. I'll be happy to entertain any questions about it.
Okay. I'm asking for a motion and a second to approve the contract with Dr. Mola.
So moved.
Second.
Any questions? Ms. Hackethorn, roll call please.
Ms. DeWitt,
Yes.
Mr. Adamson,
Yes.
Ms. Johnson,
Yes.
Dr. DeGuzman,
Yes.
Dr. Moore,
Yes.
Mr. Griffith,
Yes.
Ms. McGregor.
Yes.
Personnel policy updates.
Couple of pretty brief updates. The guts of it are in the first 3 pages. The 4th page really is just the renumbering that happens when you make a change to a policy. Like to turn the track changes on here so you can see exactly what we're doing. On the first page under 4.7 reimbursement of expenses, we have moved to number 2 into our other section, which we'll get to here in a moment, section 9.16. So you'll find that language that employees should try to use one of our county vehicles first. We've moved it into 9.16. And then also on that page, wearing seatbelts. Don't get me wrong, I'm not saying we shouldn't wear seatbelts. It's actually already in the policy under 9.16. It was a duplication, so we removed it from there. It's really more along the lines of operating our vehicles rather than reimbursement of expenses. It makes more sense to just have it there. If you go to page 2, one little change here where it said an employee who chooses to use their own vehicle for an out-of-state trip, we're going to change it to you got to get approval first to use your own vehicle for an out-of-state trip. Page 3 is really the meat and potatoes of it. And it's kind of common sense, but we decided to put it into a policy. We had a couple little issues over the last year. We wanted to make sure it was firmed up in our policy. Letter C, which is new, basically says you need to use one of our agency vehicles unless your director approves otherwise. And that's really kind of the guts of that section right there. Letter D, new letter D, is basically says you got to carpool when you can. So again, very plain language, basic ways to say use our vehicles and carpool when you can, unless otherwise approved by your director. And like I said, page 4 is just renumbering. There's no changes in there. So happy to answer any questions that you might have.
I'd like to have a motion and a second to approve the updates to the personnel policy as presented.
So moved.
Second.
Any questions? Ms. Hackethorn?
Mr. Adamson,
Yes.
Ms. McGregor,
Yes.
Dr. DeGuzman,
Yes.
Mr. Griffith,
Yes.
Ms. DeWitt,
Yes.
Ms. Johnson,
Yes.
Dr. Moore.
Yes. Mileage rate adjustment.
So while we're on the topic of traveling, I don't know how you feel about gas prices right now, but this is actually something that Gracie and Jeff and I started talking about a couple months ago, I think. But what you've got in your packet is a proposal to increase our mileage reimbursement rate, which is currently set at, this is for personal vehicle use, 0.58 cents per mile to the current IRS rate, which is 0.725 cents per mile. We're proposing this change to become effective June 1st. And what I included in here was an example of what's going on around us, right? So we've got all the surrounding counties that kind of touch Clark County, starting with us right there at 0.58 per mile. You can see the next few green, Montgomery, Miami, Shelby, and Champaign are all at that 72.5 cents per mile driven, which is the IRS rate. You've got Madison, neighbor to the east, at 0.58 right now. Fayette is just their local number of 60 cents, which they recently changed from 58 cents to 60 cents. And then Union County is also at 0.58. So the majority of the folks around us are at the IRS rate. So a couple of notes I put in the document that's in your packet about grant limitations. So all of our state and federal grants that have a maximum mileage rate reimbursement written into it, they're at the OBM rate, Ohio OBM rate, which is the 58 cents a mile. That's why we've been at that rate. We can't, even if the board sets it as higher for our agency, we can't charge the grant beyond what they set it. Most of them are at 58 cents a mile. And so we have to cover the difference, which is 0.145 cents per mile for those folks that are paid on those grants. So the budget impact, that's where you see it right here. In 2025, we drove a little over 52,000 miles on our personal vehicles here and with reimbursements for a total reimbursement of $30,000, a little over $30,000 last year. Had we had the rate of 72.5 cents a mile last year, that would have been about $38,000 for a difference of about $7,500. So that's what would have cost us last year if our rate had been higher at the IRS rate. Of that, a little over $1,000 would have been supplemented from the general fund for those grants that can't pay above the 58 cents a mile. So we think it's time to move to the 72.5 cents per mile. We know about what it's going to cost us, about $7,000, $8,000 more a year if we drive at the same rate this year as we did last year. Jeff, did I leave anything out?
No, I think you did all the highlights.
Happy to entertain questions about this.
Chris, what impact, if any, would the changes we just approved to the policy will pushing people over to your agency vehicles have? I mean, will that impact the total miles driven significantly?
Probably not, because we do a pretty good job of already enforcing what we put in policy. But like I said, there've been a couple of little blips on the radar, so to speak, in this last year where we have said, oh, it's not in policy, we need to make sure it's in policy. For the most part, staff drive our vehicles whenever possible. So probably not a big difference.
Okay. Yeah, I have no problem.
So based on what you just said, it's usually just a little bit over $1,000 difference between the 58 cent and the 72 cent.
That we would be paying out of the general fund for those who are in grants that can't pay more than 58.
Wonderful. Okay, asking for a motion and a second to set the mileage reimbursement rate at 0.725 cents per mile.
So moved.
Second.
Any other questions or discussion? Okay. Ms. Hagethorn, we have the roll call.
Mr. Griffith,
Yes.
Mr. Adamson,
Yes.
Ms. McGregor,
Yes.
Dr. DeGuzman,
Yes.
Ms. Johnson,
Yes.
Ms. DeWitt,
Yes.
Dr. Moore.
Yes. Okay. Creation of Clark County Health Department doing business as.
I think that Gracie and I probably are too excited about this, if that's a possibility. This is something that's in our strategic plan, is changing our name. People call us the Clark County Health Department. I respect the history of why we're called the Combined Health District, because we are combined with New Carlisle, Springfield, and the General Health District. But to people who are not scholars of public health history, like I am, it doesn't really mean anything. The words combined and district really don't mean anything. And so as we want to continue to be, have plain language used in all of our things, and making sure that we're reflective of our community, why not call ourselves officially what people call us anyways, and that's the Clark County Health Department. So we are allowed to do that. In case you didn't know, we're allowed to do that. It's in the revised code under 3709.011 says we can call ourselves something else. That was put in place back in 2019. And so I think it's time. And the other thing I want to show you, besides the name change, it's just the beginning of things that we're going to be doing. I'd like to show you our new logo. There are 4 versions of it. So we respected the history. It's very identifiable, that county outline of being forward and upward. That's what the arrows symbolize. But we changed the font, obviously the name, and did a couple of different variations of it. You can see in the middle, we went away from the italic font and went with a font that Gracie selected. What's it called? Roboto?
Roboto, yeah.
I'm not a font scholar either, but I just want to show you this too. This is another version. So on things that are pretty small, we probably will not use this version where it has our prevent, promote, protect down here. But I'm excited to incorporate that in because that's the national tagline of public health is prevent, promote, protect. So we incorporated it into the stair step shape of our county. And then we went with another version of it. We've never had anything like this before, where we put the CCHD inside there. And so this could be used on things that, when you're talking, when our logo gets pretty small, it's harder to read things. So we worked with a graphic design person that I know to do 2 versions of that too, where we just have the CCHD in the middle of the county and then also incorporate the prevent, promote, protect. So probably ridiculously excited about that on this side of the table, but really looking forward to just, again, being more reflective of what the community calls us anyways and knows us by. So, questions, comments?
Can I suggest that you make the prevent, promote, protect larger on the ones that you do use it for? Because it looks like part of the line.
It does, and so we did a couple of trials with it bigger, and it kind of looked a little strange because it's way bigger than the line. I don't have the version that they did for us handy, but I'd be happy to show you it. And that's why we had versions without that in there, because if we get something too small, it will look as part of the line. But if we have something large,
Like a tablecloth or
Yeah,
something.
that's the intent, is probably to put that one on a tablecloth that we have here.
Yeah.
Or here, yeah.
It's time. It's time.
It's time. And so we, Gracie and I are coming up with a phased-in approach to updating things. We're not going to be able to update everything all at once when it comes to like logo on doors and cars and all that good stuff, because it's pretty costly to do that. Shirts. So I will tell you, one of the first things that staff asks is, does that mean we can't wear these shirts anymore? Of course not. We're not going to do that. But we're gonna target, in phase 1, we'll come to you and say, this is what we want to do in phase 1. And the first thing is probably on the doors. Pretty easy to do. And then we'll start, we started looking like, man, our logo is like everywhere. It's on
Really
everything.
like to put it on.
Yeah, we do, which is good. But yeah, this will just be a phased-in approach. We're gonna have letterhead too. We do have, I would say, an almost final version of our letterhead as well. That's gonna be new, but little things like that we can do very quickly. Letterhead, we don't pre-print a lot of letterhead, we pretty much print on it as part of the Word document, but other things will take a little bit of time to make the changes, so we're excited about it. Website should be pretty easy to do.
So Dr. Thompson asked about the website.
Oh, yeah. Oh, thank you for bringing that up. So we, this was in motion about a year ago to move us to a different website domain. So as most of you know, it's, maybe you don't know, ccchd.com. A lot of C's. People leave C's out all the time, throw in extra ones. Don't put .com, put .gov, .org, all kinds of things. This has been an issue for a while. We've been talking about it. So we did get a grant to actually move to a .gov. There's been a push to get people to move to .govs and for cybersecurity, things like that. So we are going to be rolling out clarkhealthohio.gov is going to be our new domain. We tried for something that was shorter and easier, but the requirements for a .gov, you have to have Ohio in there. There were some things that were already taken. So they gave us a list of possibilities with the .govs. And that was the best one that we could pick. clarkhealthohio.gov is what we're going to be. It wasn't at the top of my list, but the ones that I wanted, they said, no, it doesn't meet the requirements for geographical location, or they were taken. So, good question.
Okay, do I have a motion and a second to create a new doing business as an adopted agency's common title as Clark County Health Department?
For a second.
Okay. All right, any additional questions? All right, Ms. Hockenhorn.
Dr. DeGuzman,
Yes.
Ms. Johnson.
Yes.
Mr. Adamson,
Yes.
Dr. Moore,
Yes.
Ms. DeWitt,
Yes.
Mr. Griffith,
Yes.
Ms. McGregor.
Yes.
Okay, staffing changes.
Thank you. We had some exciting new hires in environmental and a promotion in nursing, and then sadly a resignation and a retirement that we'll bring back to share. I think Megan and Cheyenne will share more about those in their reports.
I just want to highlight, it was in the packet a month,
A couple
maybe
weeks ago, yeah. Two months ago, probably.
or two ago, about Sandy Miller retiring. Just want to underscore that there's a lot of knowledge and experience going out the door, but definitely wish Sandy happiness in her retirement. Want to let you know too, we're having a small celebration for her, for the staff in this room tomorrow. If you are floating by between 1 and 4, you're welcome to stop by and wish her well. Some light refreshments. And so 1 to 4 tomorrow, right here.
No, what is it?
2 to 4.
2 to 4.
2 to 4.
Okay.
2 to 4.
It's on my calendar. 1 to 4. Whoops.
It's be early.
Yeah. There you go. By myself for a minute. So, yeah, Sandy's done a lot, not only for us as an agency, but done a lot with the Medical Reserve Corps. As all of you know, she was instrumental, especially during our COVID vaccine clinics, of engaging with those folks that wanted to volunteer. So just wish her well. That's it.
Okay, so I need a motion and a second, appointing new employees to public health.
So moved.
Second?
Okay, any questions? Ms. Hackenthorn?
Dr. DeGuzman?
Yes.
Dr. Moore?
Yes.
Ms. Johnson?
Yes.
Mr. Adamson?
Yes.
Ms. McGregor?
Yes.
Mr. Griffith?
Yes.
Ms. DeWitt?
Yes.
Moving on to financial reports, expenses and vouchers.
Thank you very much. Vouchers, as a reminder, these are non-payroll expenditures. They're organizing the report by fund. This month is just under 200,000, which should be about average. Most of our biggest expenses in there are either employees that we're contracting with to do the work, vaccines, and of course, our biggest is health insurance. Happy to answer any questions about any of the expenditures that appear there, though.
And I have a motion and second to approve the expenses and vouchers for April 2026.
So moved.
Second.
Any questions? Ms. Hackenthorn?
Mr. Adamson?
Yes.
Ms. DeWitt?
Yes.
Mr. Griffith?
Yes.
Dr. Moore?
Yes.
Ms. McGregor?
Yes.
Ms. Johnson?
Yes.
Dr. DeGuzman?
Yes.
Okay, motion carries. Any transfer and advances? No transfers and advances. Okay, so we don't have anything budgeted or unbudgeted. We still need a motion. Thank you very much. Okay. Monthly budget report.
The usual 3 documents. The revenue expenditure report for 8201, this is our general fund. Just one quick thing I want to point out on this one, if you look at the bottom right corner, it looks like it doesn't look like we did spend about $14,000 more than we took into the general fund. If you look at the revenues versus the expenses compared to the budget though, that number is going to grow, and we know it's going to grow. So in the next several months, next 8 months, you'll see that number getting bigger. We're about halfway through our revenues, according to our budget. We're only about a third of the way through our expenses in that account, according to our budget. So it will look in our general fund as if we are operating in a deficit. We know that's going to happen. So it's not ideal, but it's also not a cause for alarm. The next report is the Ohio Cash Basis Report. This is the one that I built the new sheet of many colors out of. In this version, I do it on a monthly basis. So the beginning balance is where we were at the beginning of the month. Revenues and expenditures in the month, and then the ending balance is where we're at the end of the month. That is all the funds individually. The next report is where I break them down into those 7 groups. Right? And then I complete the graph and things like that. If you look at the numbers or the graph, you'll see that revenues are down from this point last year, but so are expenses. I would attribute most of that to the loss of the extended operations grant. We had about 3 months of funding and spending from that grant last year. We do not have that this year. The only other thing I would say about that one, as I plan to do every month, I netted out the transfers and advances. So it looks like, if you don't net them out, it looks like we've spent and made $1 million more in each area. By netting them out, you get a more true representation of where you are. So that 8201 ending cash balance, we don't truly have that in there because we moved some money out of transfers and advances. But that's where we would be if we take those out and we actually talk about the real dollars.
Questions? Thank you very much. Appreciate that. The public health reports, Ms. Davis.
All right, good evening, Tim. So the EH world is as busy as we have been. We're still staying afloat. This week alone, we worked closely with a lot of our community partners out in the field. It's kind of been a little hectic, but I am happy to say that we are fully staffed over in EH. So we had a new hire start on the 11th. Her name is Jennifer Gerald, so we now have 3 Jennifers in our department, so when in doubt, it's probably Jennifer. So she came to us, she does have her credentials, she is an SIT, so in training, and she does have a few months of experience from another local county, so we're excited that we were able to hire her. She is jumping right into training, boots on the ground, so she's doing great. Another quick update, back on May 8th, we did receive the results from the Ohio EPA solid waste survey, and we were approved to continue to facilitate that solid waste program here at the health district. And then lastly, we are preparing for the ODA food survey, which is June 1st. So it's coming. So, but we're doing good.
Okay. Any questions for Rita? Thank you very much. Nursing and clinics, Ms. Taylor.
Yeah, so in nursing, we are not fully staffed. We have 2 open positions right now. I did just fill our full-time immunization position. She's going to start on June 1st, so I'm excited about that. But with Sandy leaving, and Sandy has been with us since 1998, so she's 26 years she's been with us, so it is definitely a loss. But we do wish her a very happy retirement and hopefully a lot of camping. But in her place, Tara Wagner is going to be promoted to nursing supervisor. Tara is awesome. She came right at the height of COVID when we were over at Penny's. And it was just kind of timing, but she's just so dependable and she's so good at what she does that within 6 months, she was running as a pod manager there when Patty, the old immunization supervisor, had to step out. So she's going to do great in that role. And yeah, I think that's it. So hopefully we get the 2 more nurses in here and get fully back up to staff.
Any questions for Ms. Taylor? Okay, thank you very much. Ms. Lambert, retail.
Thank you. The Department of Children and Youth is providing Clark County an opportunity to distribute 50 more pack and plays than our normal allotment, which is kind of nice. The only caveat is we need to have them distributed by June 30th, which is a little more than a month away. So last week I reached out to our collaborative partners and we've already started to see more calls, and then we're going to run social media campaigns starting Tuesday. So hopefully it'll make the phone ring off the hook and we'll be able to educate an additional 50 more families than normal.
Back in place. Any questions for Ms. Lambert? Okay, thank you very much. Women, infant, and children, Mr. Cook.
I will fill in for Emily as best I can. You've got a report here. Just a couple things to point out. Continuing, I know we've said it a bunch of times, continuing the great relationship we have with Springfield Regional and the birthing center, allowing us to have a WIC person there all the time. We're actually training one of our breastfeeding peer helpers to join that dietitian at the hospital to do a little bit of intake and do some breastfeeding peer support while they're there, which is, it's important. If you look, one of the things that's on here every single month is the breastfeeding initiation numbers. And if we were to put this on a graph, you can see there is a positive trend going from fiscal year 16 over the last 10 years to 26. We've gone from 58% to 68% in breastfeeding initiation rates here in Clark County. I'm sorry, that's the state average, but we've done better from 46 to 62 here in Clark. So we're on a good path here, and things like this, putting one of our peer helpers in the hospital to help, you know, those moms right there in the hospital is going to be beneficial as well. The hospital has resources, but I also know they appreciate when we're there too. So it's a great partnership. Farmers Market Voucher Program, we're getting to do that again. That's where our WIC participants get vouchers to go to the farmers market and redeem those for fresh fruits and vegetables. That's going to be starting in July. They're starting a new program where they actually scan QR codes that reimburses the farmers and the vendors that are there through the WIC program. So hopefully that they'll get their payments quicker from the WIC program than they did in the past. So looking forward to being able to pass those out to our participants here this summer. And that's all I've got for you.
Very nice.
Yes, thank you. So you have the packet, or the report in your packet. There are just two things that I'd like to highlight. First is through our Safe Communities program, Safe Communities program, every year we kick off the Click It or Ticket campaign. That's a national campaign. It starts, this year it runs from May 11th to May 31st. So meaning there's increased enforcement about wearing your seatbelt throughout the nation in Ohio and here locally. So just to give you some perspective, in the past year alone in Clark County, crashes that are involving unbelted drivers or passengers have resulted in 128 minor injuries, 27 serious injuries, and 3 fatalities. So to kick off the campaign, we held a press conference right here in this room, actually earlier this afternoon. So we had Springfield Police Department, Clark County Sheriff's Office, and the Ohio State Highway Patrol all here speaking. The newspaper came just talking about the importance of wearing your seatbelts, not just for the driver, but everyone in the car, no matter what seat. One thing Lieutenant Cook from OSP pointed out is that the time between Memorial Day and Labor Day is referred to as the 100 deadliest days because there is a spike in fatal car crashes. And it's especially for teenage drivers. So Click It or Ticket leads into that. So just again, no matter what type of vehicle you're in, the safest choice for everyone in the vehicle is to buckle up every time. So just wanted to pass that along. And then the other thing that's not in your packet, but I wanted to point out, we are very excited that the 2025 Youth Risk Behavior Survey results are finally completed and have the countywide reports are on our website and can be located in our health data reports section of our website. So as a reminder, this is a survey that we complete locally every 2 years. So we did it in the fall of last year, and it does middle school and high schoolers, so really 7th through 12th grade. And it covers a wide variety of topics, including behaviors that contribute to unintentional injuries and violence, sexual behaviors, alcohol and drug use, tobacco use, things like that. We are very fortunate that all of our schools agree to administer this because it is, a heavy lift for them. They have to administer it and it's a lengthy survey. So we are very lucky to have the buy-in of all the schools. And we thank them. And once again, we had over the threshold of the 60% representative sample size. So it can be representative of the entire school age population. And this year we were fortunate enough to work closely with Wright State and one of their senior statistical consultants to actually analyze the data. But Anna Jean Sauter and Kim Wise also helped to format and everything. So I do want to thank everyone that was involved. But we shed a lot of information from the YRBS that not every local community does. So we are very fortunate here. I know a lot of our partners that we work with are very glad that we do it. It is helpful with seeking grant opportunities, funding, things like that. So if you have a chance to go to our website and check it out, it is there. So we're excited that that is published. Thank you.
Any questions for Grace? Okay. Legislative updates.
Handful of things for you. First, special thanks to Gracie for running the meeting last month. So hopefully you got a little preview of what you're going to get next year. Appreciate that. Let's start kind of at the national level. If you have not paid any attention, don't know that there are a couple of things that are making international news when it comes to infectious diseases. That's the hantavirus and Ebola, both of which I would consider low risk for the general population. Hopefully you've continued to hear that from the experts. And unfortunately, the experts aren't always in our federal government right now. So that's why I always say, rely on your local, right? We're the unbiased, non-political piece that our community has come to rely on. And so the hantavirus and the Ebola outbreaks are both, neither of these are new pathogens for us. We have experience internationally. The only thing that I'm concerned about is with our withdrawal from the WHO, the CDC's withdrawal, making sure that we are on the front lines and contributing, and not only contributing, but receiving information back. I know that the folks that have made it through the cuts at the CDC are very passionate about what they do. So that's what's giving me hope at this point, that we still have good people at the CDC. But we're watching that locally very closely. And again, we're the reliable fact voice here in Clark County for our residents. And we'll continue to be that. In that realm of other things that you hear about nationally, I want to tell you that we are planning with our schools a tabletop exercise for measles with our schools. I believe this is the first time it's ever been done here. So we have invited all of our schools here in Clark County to participate in a tabletop exercise that we are running that would simulate a measles case, or 2 or 3, I don't want to give it all away, in a school system and what the response could be. So it is a no-fault learning environment. We're going to have it at the ESC second week of June, so give them a chance to get out of school. And we've invited, it's for superintendents, principals, school nurses, legal, public information, media folks in schools. And it's a no-fault learning environment where we're going to run through a scenario over the period of about 3 or 4 hours, simulating 3 or 4 weeks in that 3 or 4 hours. And just kind of challenge us to talk through what we would do from the health department side of things, what the school would do when it comes to exclusion of unvaccinated students, what they're going to do to help protect their staff and the rest of the students. So we're excited to host that here in a few weeks. If you also may have noticed that at the very end of April, so after our last April meeting, there were initial hearings in the Supreme Court about temporary protective status for Haitian folks. There's still not been a decision, but if you have had a chance to read all the testimony that was given and the responses from the interaction with the judges, it doesn't seem promising for overturning what this administration wants to do with folks. I don't have a crystal ball, and I'm not a lawyer or anything like that, but most of the things I've read say that it seems to be leaning towards allowing the administration to do what they want to do anyways. So we're watching that very, very closely, because obviously we know what kind of an impact that's going to have on not only this community, but potentially employers in our community. And so we're just watching that very, very carefully. Employee insurance. We have, as you heard last month from this side of the table, that where we started with our negotiations with our employee insurance provider, a lot has happened over the last month. We're not quite there yet, but I can tell you we're headed in a really good direction, not only for our fiscal bottom line, but for the employees as well. We're going to start having some meetings with employees next week to start talking about what it's going to look like for our next benefit year, which starts in July. And so hopefully be able to tell you some very good news here next month about where we're headed with our insurance premiums and coverage for the staff. A couple other things too, in this building, one of the things that in the fall of, I guess it was fall 24, when we had Homeland Security go through our building, when we were one of those buildings that was kind of being targeted and talked about a lot. Homeland Security had a lot of concerns about the safety and security of our building. And I said, boy, I wish I had a big bucket of money that would go along with this recommendations from all of you, and no one dropped one on my front porch, unfortunately. But there are a few things that we have noticed over the last couple months that it's time to do something about. And the first thing is our doors here. All of our doors are secure. but they use a punch code to get in. And so anytime we have somebody leave, we have to go through and change it. And the manual process of doing that is kind of labor intensive. And we have very old locks that have been a little challenging from the maintenance side of things. It's time to move forward with electronic swipe locks on our doors. We don't have a lot of doors here, we have 6. But it's going to cost a little bit of money that we're going to be able to pay. It was budgeted in our MAC, the Medicaid Administrative Claiming Fund that we reserve for these type of projects, capital projects. We're getting some quotes from our tech advisors. It's our RT company. This is one of the things that they do. And so we're going to be moving forward with that. I'll make sure that all of you know before we do that what that's going to look like. But it's just time to do that here at this building. Our High Street office does have electronic locks on the outside and the inside too. So it's time to upgrade us here, provide a little bit more security in this building. And let's see, legislatively, not a lot new. I know Gracie did a good job of updating you about a couple things last month when it came to the sewage changes. But I do want to mention one House bill, a new one, House Bill 820. It's entitled Radon Testing. This House bill would require radon testing in school facilities and create a home radon mitigation income and commercial activity tax credit. So a couple of things. It would require radon testing in schools within 4 years after the bill is approved, but there's no requirement to remediate if levels are found to be at the action level. So it says, hey, schools, go test. Frankly, it would be self-enforcing because if they get results back that it's a problem, our school's really going to say, oh, that's nice, and just put the paper over there. I mean, they're going to feel obligated to do something if they know. This has shades of something that was years ago called Jared's Law. Jared's Law was put in place years ago. I actually inspected schools under Jared's Law years and years ago. It actually had a component of this in it for radon testing. And so it's almost like a reboot of this, but it's specifically targeted towards schools. But the second part of that is that commercial activity tax credit that would basically give owners who found radon in their homes and put in a radon mitigation system a tax credit of up to $2,000 to help offset some of that cost of putting in a radon mitigation system. So it's interesting about the school piece. I'm going to guess there's going to be some back and forth on this House Bill 820. I don't think it's the final version of it's going to look like what it looks now, but we're watching it very carefully from an Association of Ohio Health Commissioner standpoint, what the impact would be for not only homeowners, but for schools as well. And then my last thing of the night is Megan kind of alluded to, it's been a week of working with our partners. And I'll just tell you, just give you an example. I just want to give credit to the city of Springfield. Megan and Gracie and I were at a hotel in this community until about 9 o'clock last night. It had some sewage issues. The city was right there with us. I had some great folks that I've known for a number of years now, all working together to try to solve the problem that was at this hotel. I didn't even have to ask, like Megan's like, let me make a call and my family will be fine. And so I just want to highlight the sacrifice of people like Gracie and Megan and other staff. I know it happens but it was front and center last night when we were literally in boots wading through sewage at a facility last night. So a lot of things go on in this community that nobody has any idea. And hence the shirt, right? And then you've got the shirt, right? Probably why it didn't happen. It happens every day and we do it. Nobody else knows. And that's how we like it. We don't look for the accolades. We just do it because it's the right thing to do. So, and I can just tell you, it happened last night. But I can think of no better people I'd rather spend a Wednesday night at 9 p.m. And these folks right there, and our good city folks. Chris Moore, Logan Cobb, fantastic folks. And the fire department, police, everybody was there last night. Good folks. So that's it.
Is it?
What?
Is that it?
That's it. Yeah. Did you want more? I mean, I could come up with something.
New business.
New
That'll be
business.
Additional.
Additional business.
Well, do it. Do you want an executive session?
Oh, we don't need an executive session unless y'all want to go. Yeah, we don't need it. Okay. Additional business, please.
I would just like to offer a couple of brief comments to Dr. de Guzman. I know that I've only known you for less than 5 years, but other people in this room have known you for a lot more, up to 15 years of knowledge and experience that you've shared with this board on behalf of the citizens. And I just want to say that in my experience of 5 years, and I know that reflects the 15 years, you have been a huge asset to the citizens of this county, and they don't even know it.
Sure.
That's the special,
Sure.
right? That's the special thing. You're a hero that nobody knows about. You've got a cape underneath that jean jacket that nobody knows about when you serve on this board. And so I just want to thank you personally. I know the rest of the folks on this side of the table want to thank you for your 15 years of service on this board. As a small token of our appreciation, I want to present this award to you. Get out of here. I'll let you.
Thank you. Oh, it's gorgeous. Oh,
It is gorgeous.
I know it was a difficult decision for you to decide it's time to do something else. And I know your heart will always be with public health here.
Thank you. You're the only original here for me.
Yeah, Valerie was saying that earlier, that,
I'm trying not to shoot personally, but. Thanks, Bernadette.
well, no, if I knew you were gonna be my roommate.
You stuck around?
It's like around.
So thank you for everything that is known and unknown in this community, for all your service through, you've been through a lot. You've been through COVID. Were you here during H1N1 as well?
Yeah,
on the board?
yeah.
So
Oh, yeah.
look at that. I think 2 pandemics give you the eject button for the board. So,
Two pandemics. Got it.
so thank you on behalf of all the staff and the citizens. We appreciate you.
Yes.
Well, thank you.
Mhm.
It's an honor. This is a very small compared to where I've seen Detroit, Atlanta, but mighty. And it's been an honor to serve with you guys. So, thanks.
Thank you.
Thank you. Thank you.
I'm very sad. I'm very sad and stuff because I was like, I learned so much from
That's
you,
right.
so I really do appreciate you being here when I start, so I don't want to feel like an orphan. I do have a new family. Okay, thank you. So our next regular meeting is going to be on June 18th. Here at the Health Department at 6 p.m. And
Clark County Health Department.
Clark County
Yes.
Health Department.
Right.
So can I have a motion to adjourn?
I'll make that motion.
Your-
I'll second.
Okay. Any questions about adjourning? Okay, could I have a vote? All in favor?
Aye.
All opposed? Oh, I forgot to show this.